Assalamualaikum doctors. In this video I am discussing a recall communications, that is a inhaler refused by the teenager, and also it comes as a inhaler that is refused by mother, steroid inhaler. So both are we are solving with one. So first of all, as you enter the room, she is coughing. First we are solving the teenager. So she is coughing. So we are IRCAP as usual. Can I get you a cup of water? No, I am fine. I am here to talk to you about your health. Would you like anyone to be here or shall we start? Okay. So how much do you know about your health? I feel perfectly fine. She is telling, coughing also. I'm really happy you feel this way, but I see you are coughing a lot and I am here to talk with you about importance of taking inhalers to control your asthma. No, I will not take the inhalers. May I know why? I will be addicted to it. I really appreciate your concern. I know it may look scary, but let me tell you, inhalers are not addictive. Once you improve, you can stop it without any problems. So the teenager is telling that I can be addicted with that. When we ask why, then we tell that I really appreciate admire your concern, but I want to tell you that once you improved, then you can stop taking inhaler. Then the teenager is telling, yes, but I tried it once before and I felt I had shortness of breath. Maybe because you stopped it too early before we tell you it is okay to stop it. So teenager is telling doctor, I do not wanna use it. I will be addicted. Give me syrup. So syrup she wants. So, okay, let me making a quick comparison between the syrup and the inhalers. The amount of medicine present in the inhaler is way smaller than in syrup. So, the drawbacks from the syrup is way bigger from the inhalers. Imagine with me, steroid give in very little amount to control your asthma. But if you gonna take it in the syrup, you will take it with large degree, going through the whole body. But in inhaler, it is just go through your chest. Am I clear? Okay. So she is taking syrup. We are telling her a comparison between the syrup and the inhaler steroid. In syrup, that is a big amount of steroid is going, and also it going to the whole body, where inhaler it is less amount, plus it going only to the chest. Okay. Adding to this, the drawbacks of using oral steroid for a long time, it can cause diabetes, hypertension. Also, it may increase your weight. Also, it can cause acne and excessive hair in your face. I'm sure a smart girl like you doesn't want something like this to happen. Are you with me? Also, we add some drawbacks that steroid when orally we take long term, then it causes diabetes, hypertension, excessive hair, acne, weight gain. These are, I know that you are a smart girl like you does not want something like this to be happen. Are you with me? Okay. Also, if relievers taken by as a syrup, it can cause increase in heart rate. So what is better to make syrup in inhaler, syrup or inhaler? So in syrup that increase the heart rate, but I do not want to take inhalers. Is there is any other concern? We ask that. Yes, my friends will gonna make fun of me if I took the inhalers at class. Okay, I understand this is can be difficult, but how about lies with the school nurse to go to the school nurse office and take the inhalers? They are adding to this, if you talk those inhalers regularly at home before school and at evening, the control of asthma will be better and you may not be even need to take the relievers. So the school friend is making fun. For that reason, we can liaise with the school nurse. Another thing we can take before going to the school and after coming to school evening. So in school, no need to take. Okay, doctor, but I do not want these inhalers. I just do not want it. Actually, I am sure you are a very smart girl. I know some girl with asthma refuse to take the treatment. They are so weak to do any exercise, so weak to go and enjoy their lives with their friends. But life can we get better if we got asthma under control. So we give indirect threatening like that. Some girl we know that who have not taken the asthma, they're actually easily tired. They are not. They are feeling weak, they are not enjoying their life. I know that smart girl like you not want that happen to your life, but I will avoid the triggers. Avoiding the triggers is amazing and it is a cornerstone in management of asthma, and I'm really aware of that, but it is not enough as you will not control by 100%. Are you with me? I'll think about it, but no promise. Okay, this is a good way to start. Please think about drawbacks of the syrup. We may need to use this syrup later on in case of your asthma getting out of our control. Then summary, website, leaflet and support group. So trigger names we can mention like smoking, dust, pollen, pets, garden and construction. These are. So another also communication come, that is mother is refusing the steroid inhaler. As usual, IRCAP. So how much do you know about suppose Ali's conditions. Doctor, Ali recently diagnosed with asthma, and I'm really sorry to say that the doctor gives him steroid inhaler. Can I know why you are sad? Yes, doctor. Steroid inhaler can cause many drawbacks, can cause diabetes, hypertension, it can cause many complications, doctor. I really understand your feelings and I understand why you are worried, but let me reassure you that the drawbacks may occur if he is taking high dose of steroids orally or by injections. So these drawbacks are occur by orally or injectable high dose they taken. But he is taking it orally. The amount of steroid given by inhaler is very minimal, and even though the amount that reaches his body is very smaller. So amount of inhaler steroid are very minimum and reaches in the body is also very smaller. Yes, doctor, but I am still worried. Even it is small amount, it is still steroid giving to his system. I agree with you, but it is really minimal amount, less likely to cause any harm, and even though we will monitor his blood sugar and blood pressure and will interfere immediately. But I will avoid any trigger worsen his asthma. Really, I admire your effort. Guess with me, it is clear now that why he is lucky that you are his mom. All you mentions are cornerstone of management of asthma, but it is not enough. You cannot avoid triggers or increasing factor 100%. You agree with me? So prevention is a cornerstone of management of anything, but 100% is not controlling. So he need to inhaler. Yes, doctor, but blue inhaler is enough. Actually, there is difference between the blue inhaler and the orange inhaler. The blue inhaler will treat the attack or stop the attack that already present. But the orange inhaler, which is the steroid one, it will prevent the attack from happening as steroid decrease the inflammation of the air pipes. So the difference between the blue inhaler and the orange inhaler, it will be on acute when actually the features develop. And the orange inhaler which contain steroid, it actually prevent happening because it reduces the inflammation of the air pipes. Okay, why you insist on steroid? Could you tell me its importance? So as I mentioned before, it decreases the inflammation of the air pipe, air vessels in his chest. Thus, it will decrease the frequency of his asthma, and if he will not take steroids, he will have repeated attacks. He will not be able to enjoy his life like his peers. Later on, it may affect his school performance, and also so sorry to tell you that he may have severe asthmatic attack, and that is threatens his life. So if not inhaler is taking, so there are so lots of side effects. First of all, he cannot enjoy life like his peers because he is easily get tired and asthma attack will be frequent. His school performance can be affected, and also if a severe attack, then it can be life threatening. Okay, doctor, but steroid may take my child short. Actually, asthma itself, if not controlled, it may cause short stature and it will make him shorter than if he takes the steroid inhaler. So if the Ali is suffering continuously asthma attack, he will be short because any chronic condition causes short. So if taking steroid, then much more shorter he will be. Okay, doctor, you gonna force me? Of course no, we will not force you, but let me arrange a meeting with our consultant. No, doctor. I will give you some trusted website and some leaflets, and you may arrange a meeting with the parents have children with asthma and taking these inhalers and then never regret. So I will arrange a meeting, trusted website, adding a group where the children are taking this inhaler, they are not facing any problems. We will discuss that. Okay, please have a look on these papers and these leaflets, and maybe we have another meeting after you read them. So this is all about steroid inhaler that is refused by the mother and also the teenager communication. Thank you.